drug corruption of the central institutions of society on a massive scale.
But that has gone on till our days. We have alcohol, we have tobacco.
Well, this is my very point, that every society chooses a small number of substances, no matter how toxic, and enshrines them in its cultural values, then demonizes all other substances, and uses and then persecutes and launches witch hunts against those users whenever some political pretext requires witch hunts and persecutions. So it's an old game, and it's been played in many places.
I'm fascinated by how the United States is really into legislating morality. In Europe, they've got the same victimless crime issues, and they have different approaches to them. And my friends in Europe always remind me a society has to make a choice: tolerate alternative lifestyles or build more prisons. And then they always remind me we lock up 8 times as many people per capita as they do. Either we are inherently more criminal, or there's something funny about our laws.
So hepatitis C is a virus that the main form of transmission is intravenous drug use. That's number one in the United States.
A recent report from the Centers for Disease Control and Prevention shows an increase in hepatitis C here in our region. This report shows an increase in Tennessee, Virginia, West Virginia, and Kentucky.
That affects the liver and can lead to liver failure, cancer, and even death.
Northeast Tennessee and East Tennessee in general has among the highest rates of hepatitis C in the country.
It is the #1 cause for liver transplant in this country.
We know it's here. We're trying to present the data that backs that up so we can provide the free testing. And again, we want to get into place, a place for people to go.
There is a new treatment, but everyone told me today it's really expensive, in some cases $80,000 to $90,000. And Hope for Tennessee is working with an organization who helps cover the cost for those who need it in our area.
I was in a Starbucks in Zurich a couple years ago. Went down to the bathroom downstairs, stepped inside, blue lights. I thought, what's this? Blue lights in the toilet. Well, then I realized, oh, I cannot see my veins. I couldn't shoot up if I wanted to. A lot of needle addicts, a lot of junkies on the streets of Europe because they're still alive and they're not in prison. I have to explain that to my groups. They say, these darn liberal Europeans. And I thought, well, this is frustrating for a junkie. You can't shoot up in the bathroom at Starbucks. So then, across the street, I noticed a machine that used to sell tobacco. Now it sells syringes, government-subsidized syringes. They're almost free. Nobody shares needles and passes diseases in Switzerland. That would be, like, unthinkable. The government is into pragmatic, compassionate harm reduction for the solutions to their problems. And then down the street from this needle vending machine is a heroin maintenance clinic called a Cafe Fix, where people can go, get their addiction maintained, get counseling, get their lives back on track, get a job. It's not right or wrong, but they're learning, and we can learn from them. And that's a valuable thing about travel as we struggle with persistent problems. When it comes to marijuana, of course, Europe is much more progressive in this regard. In Holland, the coffee shops sell marijuana. Now, a lot of Americans worry there's a whole reservoir of people that would love to ruin their lives smoking marijuana if only it was legal. Well, it's been 25 years since they arrested a pot smoker in the Netherlands, and what they found after 25 years is use does not go up. As a matter of fact, by every measure, Dutch people, young and old, smoke half the marijuana per capita that we do here in the United States. Portugal legalized the consumption of all drugs 10 years ago. A lot of Americans are worried about the gateway element of marijuana. You know, you smoke marijuana and suddenly you're a heroin addict. Well, in Portugal, they're worried about that too, and they've found the only thing gateway about marijuana is its illegality, because when it's illegal, you got to buy it from a criminal on the street who has a vested interest in getting you hooked on something more addictive and more profitable. We can learn from Europeans, and it's exciting.
Native Americans are twice as likely to die from hepatitis C than other Americans. Alarmed by the disease, Cherokee officials in 2012 began working with the University of Oklahoma, the Oklahoma State Health Department, and eventually federal health officials to design a Hep C elimination program that launched late last year.
The theoretical debate about some better idea that will never, ever come to pass.
You know what it all comes down to? Do you know why we can't do what every other major country on earth is doing? It's because we have a campaign finance system that is corrupt. We have super PACs. We have the pharmaceutical industry pouring hundreds of millions of dollars into campaign contributions and lobbying, and the private insurance companies as well. What this is really about is not the rational way to go forward. It's Medicare for all. It is whether we have the guts to stand up to the private insurance companies and all of their money and the pharmaceutical industry. That's what this debate should be about.
In addition to the health impact, Baker says the disease takes an economic toll.
Most folks can't work, they can't function as the disease progresses. It's a tremendous financial burden.
The Cherokee Health System serves 130,000 Native Americans in northeastern Oklahoma at its main hospital and at 8 outreach clinics. Like many Indian health systems, care is free for tribal members. Dr. Mira says that makes it easier to screen nearly everyone, a cornerstone of the Hep C elimination project.
Most of our patients will come in through our system at some point. We will be able to screen them, and once we screen them and detect that they're positive, engage them in care and hopefully treat them and cure them.
Just imagine a skeptic watching this story, maybe thinks, why should the Cherokee Nation be spending its resources on trying to fight the disease when they should really be going after drug use?
Part of our hepatitis C program is to evaluate the need and feasibility of starting opioid substitution clinics, which is it diminishes IV drug use. Definitely prevention is the answer, the long-term answer. Right now we have to put the fire out because there's a lot of people who are infected, and those people will develop end-stage liver disease if we don't treat them today.
The CDC recommends Hep C screenings for all baby boomers, but Dr. Mira discovered half of his hepatitis C patients are younger than 50. So now, under the tribe's Hep C elimination program, anyone over age 20 who comes through the Cherokee Health System for any reason is screened for Hep C, regardless of other risk factors.
We're doing age-targeted screening. We're not doing screening based on risk factors. First, because we know it doesn't work well.
When Gay Wheeler was diagnosed as part of the Hep C elimination program, she told a nurse she was worried about the treatment. Friends and a close male relative had experienced debilitating side effects like fatigue and depression.
I said, what medication am I going to have to take? And she said, well, there's new medications. And I was like, okay, but in my own mind after I hung up, I thought, wow, is that going to be like what he had to go through?
In addition to those side effects, the main drugs used to treat Hep C until a few years ago, interferon and ribavirin, cured Hep C only about half the time, and many patients had other medical conditions that prevented them from taking those drugs.
When I was treating patients in the interferon era, I could treat 10% of the patients, roughly 10% of the patients that came to my office with a hepatitis C. Best case scenario, I could cure 50%. Best case scenario.
In 2014, the Food and Drug Administration approved a new class of medications to treat Hep C. These drugs are taken orally, once a day, have few side effects, and a 90% cure rate.
We have this powerful intervention now in our hands, and our challenge as a nation is to bring together the populations who can benefit from these treatments together with those treatments and really have this excellent opportunity of wiping out this disease.
But the drugs are very expensive. Gay Wheeler took a medication called Harvoni. Its manufacturer, Gilead Sciences, charges $63,000 to $94,000 for an 8 to 12-week treatment course. Wheeler's medication came at no cost to her. Pharmaceutical companies offer substantial discounts to Cherokee patients, and the tribe uses Medicare and Medicaid dollars to cover remaining costs. But even with discounts, a bipartisan Senate Finance Committee report last year said Gilead's drug prices were putting, quote, a large burden on Medicare, Medicaid, and other government health programs. In a statement to the NewsHour, Gilead said the price of Harvoni reflects the cost of innovation, and that Harvoni and other therapies offer a cure at a price that significantly reduces hepatitis C treatment costs. The company also said it offers deep government discounts to eligible health programs. Gilead has donated $1.5 million to the University of Oklahoma for its part in assisting the Cherokee Hep C elimination program. Dr. Mira says with competing Hep C drugs in the pipeline from other pharmaceutical companies, he expects medication costs to come down.
Do you worry at all that some of the conclusions you'll reach here aren't going to be applicable outside of Cherokee Nation because most people don't have the kind of medical coverage that people here in Cherokee Nation do?
We won't be able to extrapolate what we do or find to every medical scenario in the United States, but I think everybody will learn a little bit from some of the things we did. Like, for example, we expanded age-targeted screening from 20 to 69. The recommendations right now are only baby boomers in the U.S.
John Ward from the CDC says the Cherokee program could become a national model for eliminating Hep C.
Well, the number one lesson we can learn from the Cherokee Nation is the power of political commitment to tackling this problem.
I'm very thankful that...
So far, the Cherokee program has treated almost 300 Hep C patients, and of those who've completed treatment and finished evaluation, 96% are disease-free, including Gay Wheeler.
29 million people still have no health insurance. We are paying the highest prices in the world for prescription drugs, getting ripped off. My proposal: provide health care to all people, get private insurance out of health insurance, lower the cost of health care for middle-class families by $5,000. That's the vision we need to take.
I loved going to Europe because we have smart, similar people dealing with similar problems and coming up with different answers. We can compare notes. Europe and America are both wealthy, Christian, democratic, capitalist societies. We're all passionate about government by, for, and of the people. I've thought about this, and I think there's a difference. Here in the United States, we're all about government by, for, and of the people via the corporations we own. Now, that's not a judgmental statement. That's just a kind of an observation, and what might make sense for a government to provide a good environment for our corporations to prosper. I think in Europe, they've got government by, for, and of the people in spite of the corporations they own. I think their government goes to bat for the future, for the poor, and for the environment at the expense of their businesses.
Better idea that will never, ever come to pass.
I love to have European friends as sounding board so I can test out ideas and confusion and frustration for me. And I've got a good friend in Switzerland who's a school teacher, teaches in a little village, a very traditional village where almost everybody has the same last name. And when I visit with Ollie and his wife Maria and their kids, I love to ask them questions. Recently I asked Ollie, how can you Swiss people so docilely pay such high taxes? And without missing a beat, he said, well, what's it worth to live in a country where there's no homelessness, no hunger, and where everybody, regardless of the wealth of their parents, has access to quality health care and education. Now, Ollie is not a crusader. Ollie's just a capitalist with a European social ethic. And it's interesting to learn from them. One thing that's occurred to me recently is Americans are loving, compassionate people, but we're not very good at grappling with the gap between the rich and the poor. There's something in our upbringing that makes it very tough to deal with that honestly. When you travel, you have the poor reaching into your window. You can't escape it if you're traveling honestly. And for 30 years, I've had the poor reaching in my window. And it's been a powerful impact in the value of my travel. And I'll tell you, I've learned that even if you're motivated only by greed, if you know what's good for you, you don't want to be filthy rich in a desperately poor world. It's just not a pretty picture. I was down in El Salvador last Christmas. Any middle-class neighborhood has to pool its money to have an armed guard on the corner just to protect them from angry poor people. And you don't want to raise your kids behind designer fortifications. We're on a track to that if we don't learn from the other parts of the world that have not dealt with this very smartly.
What the campaign is about is a very radical idea. We're going to tell the truth.